The Elevate-RR study compared acalabrutinib to ibrutinib in previously treated high-risk CLL patients. In addition to the progression-free survival and things that have already been reported, we recently looked at the mutational profile of patients at the time of relapse on those two different treatment arms. We did find that BTK C41S mutations were commonly acquired at the time of relapse in both arms. Interestingly, in this particular study, it was more commonly seen in those patients on the acalabrutinib arm than the ibrutinib arm. It's not entirely clear that this is really a biologic difference. There might be other reasons for this, but in any effect, both arms did have relatively high rates of BTK C41S mutations at relapse. Interestingly, we saw T474I mutations, which we commonly are associating with treatment with pirtobrutinib and non-covalent BTK inhibitors, in a relatively high fraction of patients on the acalabrutinib arm, and always at the same time as we saw C41S mutations. So this is something that certainly deserves some further study. PLC gamma 2 mutations were relatively uncommon, seen predominantly in the ibrutinib arm. And then we did see acquisition at the time of relapse of other CLL driver mutations, things like TP53, that just suggest ongoing clonal evolution in those patients at the time of relapse.